It's very important to know that about 1 in 7 men will be diagnosed with prostate cancer during their lifetime, and your chances of getting it are 1 in 3 if you have a close relative with the disease. The risk jumps to 83% if 2 close relatives, your father or brothers, have been diagnosed with the disease. Have I scared you? Don't be, because we've got Dr. Edward Cohen from Genesis Healthcare Partners with us. Good morning. How are you?
I'm doing great, thanks.
I could talk to you for an hour about this. Really, I'm going to tell you, it's a strong history of prostate cancer in my family. Uncles, my father, I have an enlarged prostate. I get it checked once a year, actually this year twice, and I just want to know who should be screened.
Well, I'm glad you have a good relationship with your urologist at this point.
Right, first name basis.
I think every man over the age of 50, and if you're at high risk, which you are,
right,
should be starting at age 40. If you're African American, starting at age 40, should be screened for prostate cancer. There's a lot of controversy right now with whether we should screen or not to screen, having to do with the United States Preventive Task Force a few years back saying the PSA was not an appropriate screening test for prostate cancer.
I've always wondered that.
Because we were essentially overdiagnosing and overtreating. And the statistics are really the following, is that when I first started in practice over 25 years ago, PSA was first coming on board. We were diagnosing and treating a lot of prostate cancer. And over those 25 years, the death rate of prostate cancer has dropped about 20%. The problem is that we cured a lot of people that probably didn't need to be cured.
Really?
Yes. And so at this stage, we're beginning to realize there's a lot of low-grade prostate cancer that can be followed. And it's not about whether to screen or not to screen. It's about whether to treat or not to treat. And so that's been one of our bigger points now as we see our patients and diagnose our patients.
Okay, so first, you do want to get screened for sure. That's not the if. The if is whether or not you get treated, and you decide through the testing, the PSA, and say, is there other testing? I mean, is there something else you can do?
Well, you start with the PSA testing and digital rectal examination. You need both of those as part of the evaluation. But it's really the biopsy that makes the diagnosis, and that's where the issue comes up, is whether or not there's risk to the biopsy. There are some small risks, and we try not to biopsy until we know that there's a good indication, changing in PSA value over time, digital rectal examination changing over time. The fact that you have a very high family risk would make you someone that would put into more likely to want to biopsy a little earlier than later.
So I'm 47. We'd be looking at that in about 2-3 years?
No, you would start now as long as your PSA is stable, just to continue to watch you as long as your digital rectal examination is also stable. But when it gets to the point of needing a biopsy, you undergo the biopsy, and then it's with that information. Are you low grade? Are you high grade? We now have some new genetic testing to look at the prostate cancer itself and help stratify patients into high-risk and low-risk categories.
Genesis Healthcare has this.
Every urologist has access to these advanced tests. And this allows us to decide whether or not you're someone who is appropriate for active surveillance. That doesn't mean benign neglect or we're not going to, we'll see you back in 2 years. It means actively following the patient with prostate cancer, but without treatment, which is following the PSA, repeat biopsies, further imaging, possibly with an MRI, to help us decide when and if you begin to advance, and we're going to need to move ahead with some advanced treatment.
Okay, I know we've got to wrap here, but real quickly, exercise, low-fatty diet, those things help as well, right?
There's some literature to support a lot of that.
Okay, how do folks find out more about Genesis Healthcare?
mygenesishealth.com.
All right, Dr. Edward Cohen, thank you so much. I actually feel a little bit better about it, even though it runs strong in my family. We appreciate your time.
No problem. Glad to be here.